Dr. Anthony Fauci is, of course, the director of the National Institute of Allergy and Infectious Diseases and joins me now. Dr. Fauci, thank you. Welcome back to the program. I have to ask you about a lot of the comments that the president has been making about his own health. He has said that he is cured, that the disease just went away, that he now has antibodies, that he could be immune, and that Regeneron is a cure, not a therapeutic. Can you help us sort through this? I know you haven't examined the president, so you're not involved in this case, but just in terms of the public health messaging that is coming right now from the administration.
Well, I think Andrea, if we take one by one the statements you made, I mean, obviously I could only give, surmising about that since I have not directly been involved in the president's care. But first of all, saying that he's cured now. He certainly looks good and apparently feels good. One of the issues that we all have to be aware, and his physicians are aware of this, that the history of COVID-19 is that you could look and feel like you're doing reasonably well, and after a couple of days, you could have a downturn, namely have a reversal. That's possible. The chances of that happening, I don't know. As good as he looks, I don't think that's going to happen, but I don't know. But you have to be heads up that it might happen. Regarding the antibody that he received, it's a monoclonal antibody. The data, the preliminary data from those antibodies are favorable. I think it's a reasonably good chance that the antibody that he received, the Regeneron antibody, made a significant difference in a positive way in his course. But when you have only one, we refer to it in medicine as N equals 1. When you have only one, you can't make the determination that that's a cure. You have to do a clinical trial involving a large number of individuals compared either to a placebo or another intervention. Having said that, there is a reasonably good chance that that, in fact, made him much better.
What concerns would you have about him still being infectious?
Well, the general guideline from the CDC says that 10 days from the onset of symptoms that you can essentially consider someone non-infectious. You can definitively show that by another one of the recommendations that had been made about 2 negative PCR tests 24 hours apart. So if the president goes 10 days without symptoms and they do the test that we were talking about, then you can make the assumption based on good science that he is not infected. But you just have to wait and make sure you go through those particular benchmarks that are delineated in the CDC guidelines.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.